What happens when you mix two vaccine shots? Have you ever wondered or thought about what happens really if you mix COVID-19 vaccines, receiving a first dose of one vaccine and a second dose of a different inoculation? Well, scientists also want to know. Why? Well, because mixing doses might actually give governments more flexibility to essentially stretch the available vaccine supplies across populations, ensuring more people get vaccinated and that doses won't go to waste. As Canada and other countries are actually considering mixing COVID-19 vaccines, researchers and public health officials are examining different strategies, such as blending two different shots, as many low and middle income nations try to figure out how to cope with vaccine shortage and scarcity. There's also speculation that at least for some of the vaccines, receiving a second dose of a different vaccine might actually produce a stronger immune response. So what do scientists think? What do they have to say? Well, a British study has found that people experience more chills, fatigue and general malaise after receiving a different vaccine as a second shot. People who received the Pfizer vaccine and then followed that up by the AstraZeneca jab or vice versa were more likely to experience uncomfortable reactions to the second dose than people who received two doses of the same vaccine. And this is based on what Oxford University researchers have said in a note that was published in the medical journal Lancet. What are the side effects? Well, these reactions include flu-like symptoms such as fever, muscle aches, lethargy, and a general feeling of being unwell. The scientists said that none of these side effects were severe, describing them as mild to moderate. They also said that the symptoms were short-lived, lasting at most for a few days, and that there had been no other safety concerns so far with mixing the Pfizer and the AstraZeneca vaccines. For example, about 10% of the participants based on the study who received two jabs of the AstraZeneca vaccine experienced chills, whereas 40% who got the AstraZeneca shot followed by another vaccine followed by a Pfizer shot suffered those side effects. Roughly 25% of the volunteers who had two jabs of the Pfizer product developed chills, compared with 45% of those injected with Pfizer and then AstraZeneca. Most of the side effects were mild or moderate and only lasted for a couple of days. None of the participants, importantly, had to be hospitalized. The scientists also cautioned that the study only included people over the age of 50 and that it is perhaps possible that younger people might just react differently.